أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على أشرف الأنبياء والمرسلين وعلى آله وصحبه أجمعين أما بعد فأعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Dear brothers and sisters, elders and the youth, dear listeners, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu. You're listening to Radio Mark on 107.1 FM from the heart of Bradford with myself, Muhammad Shahid. It's a nice sunny day of Tuesday, even though the temperature is in the minuses this morning. But it's a nice bright day of Tuesday, the 8th, I believe, 8th of March 2022. At the time now is approximately 5 minutes past 10 in the morning. This program has been brought to you on behalf of Al-Markaz Homeopathic Clinic, which is based in BD7 Bradford, BD7 2JX, off Beckside Road on Beckside Lane. Al-Markaz Homeopathic Clinic. It's a weekly program with myself and Dr. Abaid Rahman Saab. This program is every Tuesdays from 10 till 11 a.m. Every Tuesdays 10 till 11 a.m. where we talk about different health issues, different health problems, different illnesses, the symptoms. What are the illnesses? Certain illness we choose each week, and today's illness that we'll be talking about is gastritis, which Dr. Abessa will go through in more detail what it is. We talk about the symptoms. We talk about the reasons why we get certain illnesses. We talk about which kind of people, what age, females, males, who are the people who are more likely to get these certain illnesses. And then we talk about the treatments, how we can treat these illnesses. As we know, alhamdulillah, by the mercy of Allah, every illness, there's a treatment for every illness, there's a cure for every illness but death. Obviously, death is something that there's no cure for, but every other illness, there's a cure. And when we are ill, again, it's a blessing from Allah that we have patience, and with that patience, there is so much reward. When we are ill, illness is with us. As long as we have these physical bodies, we have our minds, our bodies, illnesses will be with us. And illness is such a thing that it tests a person's patience. It tests your patience. And when a person is ill and he has patience and he thanks Allah, Allah Ta'ala rewards him immensely. There's, you hear a story about Hazrat Yunus alayhi salam when he was ill. He had a skin condition where, his skin was so bad that there were like maggots eating his skin, and whenever like a maggot or something it fell out, he would pick it up and put it back in there again, saying that Allah Ta'ala has wrote his rizq in here. So they had so much patience. And illnesses, we get ill, from the day we're born till the day we die. Throughout our life we get many illnesses, and with these illnesses we have to find the cures for them. There are many ways you can find cures for illnesses. And one of the best way is you have a good diet, you have a good lifestyle, good lifestyle. And then another way to cure your illness is through our clinic, Al-Markaz Homeopathic Clinic, where the medicine there is purely natural medicine with zero side effects. With homeopathic, if it doesn't cure you, it doesn't harm you. And alhamdulillah, we have a very high success rate where many people have taken our medication, and through Allah Ta'ala's blessing, through His will, they have been cured. So now I will go on to our Dr. Saab, Dr. Abaid Rahman Saab, who is a qualified and experienced homeopathic practitioner, been in this field for many years, and he's one of the doctors at Al-Markaz Homeopathic Clinic with Dr. Humaira, who is a lady doctor, and also our main head doctor, which is Dr. Mufti Qazi Asarada Sahab, who is also a qualified homeopathic practitioner. So over to Dr. Sahab. Dr. Sahab, Assalamu alaikum wa rahmatullah.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
How are you feeling this glorious morning, like they say?
Alhamdulillah, Allah ka bahut bahut shukr.
How's your health?
Alhamdulillah, bilkul theek hai.
Dr. Sahab, today's topic we're talking about is gastritis. Gastritis. So, okay, over to you. What is gastritis? ये क्या कहते हैं ये क्या बला है?
Gastritis जो है ये पहले तो ये मैं बताता हूँ आपको कि जब हम कुछ भी खाते हैं, खुराक जो फूड खाते हैं हम, तो वो मुंह के बाद हमारे फूड पाइप, जिसको ईसोफेगस कहते हैं, उससे मैदे में जाता है। स्टोमक। तो मैदा जो है ये एक थैली नुमा ऑर्गन है,
Okay.
और इसमें बहुत सारे ग्लैंड्स होते हैं जो गैस्ट्रिक जूस जो है वो प्रोड्यूस करते हैं, और उसकी वजह से हमारा खाना जो है फिर वो हजम होता है।
The gastric acid is it?
जी, तो वो जो मैदे की अंदर की जो लेयर है, अंदर की जो तह है, उसमें इन्फ्लेमेशन जब हो जाती है तो उस कंडीशन को गैस्ट्राइटिस कहते हैं।
So एक गैस है और
जी
राइटिस
इसमें
है।
जी इसमें जो इसके सिम्टम है वो उसमें जो है वो गैस भी होती है। तो मेन जो इसमें ये है ना कि मैदे की जो अंदर की जो तह है, अंदरूनी जो तह है, उसमें जो है इन्फ्लेमेशन हो जाती है, सोजश हो जाती है, और इस कंडीशन को जो है वो गैस्ट्राइटिस कहते हैं।
So gastritis, what are the symptoms? How do you know? Your stomach, there are many illnesses to do with the stomach, aren't there?
जी
So you could have normal stomach ache, you could have just you could be, you could have some other kind of pain, around your stomach. But how can you tell it's gastritis? What are the symptoms of gastritis?
गैस्ट्राइटिस में ये सिम्टम यही है कि पेट में दर्द रहता है, गैस हो जाती है, ब्लोटिंग होती है, इसके बाद जो खुराक की नाली है इसोफेगस, उसमें खट्टापन, डकार, इस तरह से ये पोजीशन हो जाती है। दर्द बहुत रहता है उस स्टमक के पॉइंट पर, मैदे की जगह पर। ये इसकी जो सिम्टम है।
Okay, let's have talk about gas. When people, I see mainly the elders really, तो कहते हैं हमें गैस हो गया, this they burp a lot.
जी जी
तो ये भी उसके एक symptoms है जो
जी यही है ना कि जब जो गैस बनती है मैदे में, तो फिर वो मैदे की जो नाली है उसके ऊपर की तरफ आती है, तो फिर इससे होता है
वो डकार आते हैं,
और
people start
इसमें
burping.
इसके सिम्टम में ये भी है कि पखाना जो है उसका कलर डार्क हो जाता है, कभी कभी उसमें
क्या चीज सॉरी?
पखाना जो है स्टूल
Okay.
जो है वो डार्क हो जाता है।
Okay.
उसमें जो है कभी कभी ब्लड भी हो सकता है
Due to the gastritis.
जी
ये भी उसकी एक symptom होती
जी
है. Okay. And doctor, you briefly explained what gastritis is, but let's go over it again. What is the reasons we get gastritis? What's the reasons for people getting gastritis?
इसकी रीज़न जो है, इसमें जो सबसे बड़ी रीज़न है, एक बैक्टीरिया है, H pylori उसको कहते हैं, हेलिकोबैक्टर पाइलोरी उसका पूरा नाम है। उसकी वजह से ये ज़्यादा इसके चांस होते हैं, और उसकी इन्फेक्शन की वजह से। बाकी वजूहात में जो है या रीज़न में और भी आते हैं, स्मोकिंग है इसमें, सिगरेट नोशी,
Okay.
अल्कोहल, शराब नोशी, दूसरा वही बात फिर स्ट्रेस वाली आती है।
स्ट्रेस भी इसी में आ जाता है।
इसलिए हर बीमारी के काज बनती है ये। जो हमारा लाइफस्टाइल है, स्पेशली फूड्स का, उसमें स्पाइसी फूड, फ्राइड फूड, तली हुई जो खाने हैं, तले हुए
जंक फूड जो है
जी, इसमें नींद से का भी इसमें होता है। कुछ जो बंदे हैं, वो लोग जो हैं वो नींद ठीक तरीके से अपनी पूरी नहीं करते,
स्लीपिंग डिसऑर्डर वगैरह आता है
जी, ये भी है। यही वजह इसमें कुछ आती हैं।
Okay, so the reasons, as you explained, there's a certain bacteria which causes it. And that bacteria, how is that bacteria created? Do you know about?
जी जी, ये जो बैक्टीरिया जो है, ये ऑलरेडी जो हम जब खाना खाते हैं, स्पेशली जो बाहर के खाने होते हैं, तो उसमें जो है वो ये बैक्टीरिया आता है। इससे जब फिर वो एक सेहतमंद बंदा उसको अपने फूड के ज़रिए अपने स्टमक में उसको ले जाता है, तो फिर उसकी वजह ये बनती है। बाज़ कहते ये जो बैक्टीरिया है, इसकी इन्फेक्शन जो है वो खुद ब खुद भी बाज़ का कुछ दिनों तक ठीक भी हो जाती है। कई दफ़ा पेशेंट को पता ही नहीं चलता कि मुझे ये इन्फेक्शन हुई है या नहीं। तो बहुत से केसों में ये होता है कि वो खुद ब खुद भी ठीक हो जाता है। लेकिन गैस्ट्राइटिस इसकी वजह से होता है, और फिर बाद में गैस्ट्राइटिस जो है ये स्टोमिक अल्सर इसका जो है हो जाती है। इसकी वजह से गैस्ट्राइटिस की वजह से बाद में कैंसर तक भी ये स्टोमिक कैंसर भी इसकी
Okay,
वजह
so
से होता
gastritis, if it's not treated in good time, it could
है।
lead
जी
to stomach ulcers, and that eventually, unfortunately, could lead to cancer as well, as
जी
you
जी
mentioned. So these illnesses, you know, sometimes you think this illness is a small illness. Gastritis also, you know, we as some people see as we got gas in our stomach, we got, you know, extra gas is bloating, is painful. But if you don't, you know, get it in time,
जी
if
जी
you delay in the treatment, then like Dr. mentioned, it could lead to ulcers in your stomach, which again are very painful. And besides the ulcers, it can also eventually, unfortunately, it could lead to cancer in the stomach as well. So, my brothers and my sisters, if any of you are suffering from this illness of gastritis in your stomach or any kind of stomach pain, don't just delay in the treatment. Don't just think that okay, it's just the normal stomach ache and I'm okay. I can deal with it, right? But what to do is get treatment straight away. Go to your doctor or contact us Al Marcus Homeopathic Clinic on Bexar Lane. Our number is 01274 270043. That's 270043. Book an appointment and see Dr. Abaid Sahib, inshallah. And through Allah Ta'ala's will, you'll be treated. Another question that we have, Dr. Sahib, is how can we diagnose gastritis? How do we diagnose this problem?
जी बिल्कुल, ये तो बहुत ही ज़बरदस्त आपने सवाल किया है। अगर कोई भी बंदा या पेशेंट जो है वो ये सिम्टम देखता है कि उसको महसूस होता है कि मुझे गैस्ट्राइटिस हो सकता है, तो अपने डॉक्टर से रब्ता करके इसका जो है जो टेस्ट है उससे डायग्नोज कर सकते हैं। टेस्ट इसके ये है, एक तो ब्लड टेस्ट से भी होता है, उसमें पता चल जाता है कि जो मैंने बैक्टीरिया का बताया है कि H. pylori अगर बैक्टीरिया है तो उसमें वो आ जाएगा। और दूसरा इसमें जो है जो एंडोस्कोपी है, इसके ज़रिए से कैमरा डाल के वो इसके ज़रिए से वो अल्ट्रासाउंड के ज़रिए से वो डॉक्टर चेक करते हैं कि उसके मैदे में इन्फ्लेमेशन है, सोजिश है, तो ये इस तरीके से डायग्नोज हो सकता है।
Okay, so to get diagnosed, if you have any stomach issues as such you think is gastritis, so contact your doctor, get a certain test done. Like my doctor mentioned, one of the tests is blood test. Blood, I think, is one of the things that you can find all illnesses through your blood count, mainly. Then get all the tests done and make sure you find out it is this illness. So, Dr. Saab, the next question I have for you is, so we've got the reasons for the reasons. When it comes to reasons, you know, all these illnesses, they don't just come out of the blue. वैसे तो आदमी हर चीज सही तरह कर रहा था, वैसे कोई बीमारी ऐसे तो नहीं आती. Lot of the illnesses, my brothers and my sisters, is we cause these illnesses. You know, we bring these illnesses to us. Example, now Doctor mentioned that, you know, one of the causes for the illnesses, example, smoking. Smoking is a dirty habit. It's a bad habit, and if any of you guys do smoke, you know, try your best to stop this habit, because first of all, it's really bad for your health. Second thing is very bad for your pocket as well. It's not cheap. It's an expensive habit, and that money, you know, you could use that in so many good things. You know, you could use it for your family, for your children, for yourself, and you're just burning. Basically, you're basically burning your money.
ये थोड़ी सी इसमें मैं प्रोग्राम से थोड़ा सा हट के आया है। वैसे तो इस डिजीज में गैस्ट्राइटिस पे जा रहे हैं हम
जी हाँ।
तो, लेकिन थोड़ा सा तंबाकू नशी या स्मोकिंग के बारे में बताता हूँ कि अक्सर लोग ये समझते हैं कि ये सिर्फ हमारी लंग्स पे, फेफड़ों पे ये असरअंदाज होती है, जबकि पूरे जिस्म पे ये असरअंदाज होती है। वो कैसे कि जब हम सांस लेते हैं तो ऑक्सीजन जो है वो हम अंदर लेते हैं और कार्बन डाइऑक्साइड बाहर जाती है, जबकि इस अमल से कार्बन डाइऑक्साइड ही फेफड़ों में जाती है और कार्बन डाइऑक्साइड बाहर जाए, जब फेफड़ों में ऑक्सीजन नहीं जाएगी तो ब्लड साफ नहीं होगा, ब्लड साफ नहीं होगा तो हमारे जिस्म जो है, हमारा जिस्म छोटे छोटे सेल से बना हुआ है, और सेल की जो खुराक है वो ब्लड, साफ ब्लड है। तो जब साफ ब्लड नहीं मिलेगा तो वही मिसाल है उसकी कि किसी को गंदा सेब दे दें, ख़राब सेब दे दे, उसको कहेंगे ये खाए, तो वो अगर खाएगा तो बीमार होगा। इसी तरह हमारे जो बॉडी के सेल है वो सारे बीमार हो जाते हैं जब हम स्मोकिंग करते हैं। तो
I think, Dr. Saab, one day we'll have a program just on smoking.
Inshallah.
I think this is very important. We'll have one whole program, inshallah, on smoking and the obviously there are so many damages of smoking, and there are zero benefits really, all damages, and we're going to talk about how you can stop smoking. And I think a lot of times we do understand the losses of it, we do understand, but I believe a person needs willpower really to stop. So inshallah we'll have a program on that. Going back to gastritis, you mentioned that the reason for this is
इसमें दो रीज़न और भी बताता हूँ मैं कि कुछ मेडिसिन है, स्पेशली जो एंटी इन्फ्लेमेटरी जो मेडिसिन है, जैसे एस्प्रिन होगी या पैरासीटामोल होगी, तो इसके ज़्यादा इस्तेमाल से जो है ये भी एक रीज़न है, और कुछ जो डिजीज़ हैं उनकी वजह से भी ये हो सकते हैं।
अच्छा डॉक्टर, आपने कहा पैरासीटामोल, दरअसल हमारे लोगों के लिए ये दवाई नहीं है, ये तो एक किस्म का खाना है ये।
इसमें बहुत नुकसान है।
Seriously, the paracetamol, lots of our Asian people, especially our Pakistanis, we have two main medicines for every illness. Two main medicines. That is one paracetamol and one is Vicks. जो विक्स है ना और पैरासीटामोल, हमारे जो है ना जो बुजुर्ग लोग, जवान भी Pakistani community, I don't know about any other community, but Pakistani community, we believe that paracetamol has cure for every illness, and again Vicks again. But paracetamol, Dr. many years ago I was reading this article, right? And this article, it mentioned that there's a place in India where this certain religion sect of Hinduism, where the person and the family members passed away, they would take them to this jungle, mountainous kind of area, and they would put the dead bodies, naked bodies over there. And their religion was that you put it there and you let these these eagles and crows eat the flesh, right? So this was happening for centuries and centuries. So many years ago, they were leaving bodies there, but there were no birds, no eagles, no crows to eat the flesh there, and the bodies were just rotting over there. There was one doctor who went there and he found a dead crow. He found a dead crow there, and he did an autopsy, post-mortem of the crow, to find out why these birds dying. तो जब ने उसकी जो किया ना उसने उसका post-mortem, तो he found paracetamol in the crow's liver. In the crow's liver, he found paracetamol. So he came to the conclusion that these birds have died because these people are having so much paracetamol, and through their flesh they've gone into the birds and it's killed the birds.
The paracetamol के side effect है, उसमें ये बड़ा side effect है कि liver पे जो है बड़े असरअंदाज होती है।
There's evidence over there.
Gastritis के हवाले से जैसे मैंने बताया कि एंटी-इन्फ्लेमेटरी जो मेडिसिन है, फॉर एग्जांपल दिया मैंने पैरासीटामोल और एस्प्रिन की, इसके अलावा आइबुप्रोफेन दिया, उस पे वो भी है, बाकी भी इसी तरीके से जितनी एंटी-इन्फ्लेमेटरी जो मेडिसिन है वो।
So besides that, so see, if you understand the reasons for certain illnesses, then we can try to avoid them things. We can avoid them. That's the first step, really. If you're diagnosed and you got gastritis, you got the symptoms, right? And then once you know the reasons that we're explaining now, so reasons that we mentioned, there's certain bacteria through a diet, smoking causes this, alcohol causes this, stress is the cause of almost every illness. Your lifestyle, if you're not exercising, you're not eating clean food, your junk food, your unhealthy food, because food is what's going inside your stomach. So this main cause for gastritis is the wrong kind of food that you have as well. If you don't sleep well, ab dekha Dr. Saab ke, a lot of people sleep very late. And one of the reasons for them sleeping late is the social media. Key log, for hours and hours, they'll be going on TikTok, on the Facebook, Instagram, Snapchat for hours throughout the night, and then they sleep so late. And the morning they have to go to work. So this sleeping disorder, lack of sleeping, that causes it as well. And then, as you mentioned, certain medication. So we've covered the reasons for this. So next, Dr. Saab, I'm going to ask you, जो मैंने देखा है डॉक्टर साहब के जो गैस से है, हमारे बुजुर्ग कहते हैं गैस हो गया, हमें गैस हो गया, right? So I have always seen people, I've always heard people complaining about this illness. The people who are over the 50, 60 age group, is that true? Which kind of people, the males, females, what age are most likely to get this illness?
ये तो किसी भी एज में हो सकती है। जैसे मैंने बताया कि ये जो जैसे हमारा लाइफस्टाइल फूड है, इसमें स्पाइसी फूड हम खाते हैं, हाई फैट वाले फूड खाते हैं, तो ये तो कोई किसी भी बंदे से। और फिर जो बैक्टीरिया इन्फेक्शन का, जैसे मैंने बताया कि इसमें जब इसके तो ये भी किसी भी को हो सकता है।
There's no specific age for this illness. We come across a lot of people that are older people that complain about this illness. And that's the reason I'm asking. So this illness can come at any age really, depending on the reasons. If you're having a lot of junk food, a lot of spicy food, then you can get this. Okay, so let's have the last question we have. So we covered what is gastritis. We know the symptoms of it. We've gone through all the reasons why we get this illness. We've gone through who gets it. Basically, anybody can have this illness. And when this illness, as we mentioned before, this illness, if you don't treat it in time, if you delay too much, you cause it ulcers in stomach, and through ulcers, right? There are possibilities, very low possibilities, but there still are possibilities of being cancerous as well. So, I think after the break, inshallah, we're going to go through the question. If you have any questions regarding gastritis or any illness, you can call in to us. Our studio number is 570900. That's 01274 570900. That's 570900. Just remind you, this program has been brought to you on behalf of Al-Markaz Homeopathic Clinic, a clinic that specializes in homeopathic medicine, which is based in the SM Complex building, Al-Markaz Al-Islami, BD7, 2JX. And you can call us if you have any kind of illness. Today we're talking about gastritis. Each week me and Dr. Abaid Rahman Sahab, we are here talking about different illnesses, the symptoms, the reasons, the treatments. And each time we ask you, if you are suffering from any illness, to please contact us, give us the opportunity to serve you. Our consultation is only £30 for the first consultation. With our £30, Dr. Saab will go through your illness, all your problems, and he will give you medication for 1 week, 1 week's worth of medication. Once you start taking medication, then within 3 to 6 months, inshallah ta'ala, some illnesses cure a lot quicker, some take time. As Doctor mentioned before, there's a person who's been ill for 10 years. Now, you can't expect to be better in 10 days. Okay, some person's got illness for like 10-year illness. You can't expect that illness to go in 10 days. You have to have patience. And thing with homeopathic medicine, the biggest beauty about this medicine is that it has 0 side effects, and it gets to the root of the illness. It doesn't just cover the illness, it gets to the root of it and wipes the illness out. But again, you have to have a lot of patience. You have to have a lot of patience, and through Allah Ta'ala's will, you will be cured. So we're going to go for a short commercial break. But before the break, let me remind you, our number for the clinic is 01274 270043. That's 270043. Please book yourself an appointment. See the doctor. We have a lady doctor, Dr. Humaira, with a lady doctor, Dr. Abaid Rahman, for the males. And if you want to see a lady doctor, you can book an appointment with Dr. Humaira. Please call us at 01274 270043. That's 270043. Al-Markaz Homeopathic Clinic, where we can treat, inshallah, every illness that you may have. We can't do no surgeries or operation, but we can treat illnesses. So inshallah, we'll be back straight after this short commercial break. Dear listeners, brothers and sisters, welcome back. After this short commercial break, you listen to Radio Mark on 107.1 FM. From the heart of Bradford with myself, Muhammad Shahid, and with me in studio I have Dr. Abaid Rahman. Our program is on behalf of Al-Markaz Homeopathic Clinic, a homeopathic clinic based in Bradford, BD7. And if you want to book an appointment, if you have any illness, any kind of illness, you can book an appointment with us and have a consultation. One consultation, first consultation is only £30 with a week's worth of medicine. We have Dr. Abaid Rahman Sahab, we have Dr. Humaira, a lady doctor, and we are open Monday to Saturday.
Monday to Thursday and
Monday to Thursday,
and Saturday.
and Saturday. So Friday and Sunday we're closed. To book an appointment, give us a call. Our number is 01274 270043. 270043. Today's topic that we're talking about is gastritis. Gastritis, which is a stomach condition, a stomach illness. We've been through the symptoms, we've been through the reasons why we get gastritis, and the final part of the program is where we talk about the treatments for gastritis. What is the treatment? So I'll pass you over to Dr. Abaid Homeopathy. Dr. Sahab, what are the treatments for this illness?
जी ट्रीटमेंट जो है ये हर पेशेंट के हिसाब से होम्योपैथिक की मेडिसिन जो है वो डिफरेंट होती है। होम्योपैथिक में इसकी बहुत ही अच्छी ट्रीटमेंट है। यह है कि हम जैसे मैं हार्ट डिजीज़ की मेडिसिन के बारे में बताता हूँ कि हमारी मेडिसिन जो है वो हर पेशेंट में डिफरेंट होती है। सिम्टम के हिसाब से, अलामात के हिसाब से हम मेडिसिन जो है वो चूज़ करते हैं। तो अल्हम्दुलिल्लाह इसका बहुत अच्छा इलाज होम्योपैथिक में है।
Okay, so as doctor mentioned, with the homeopathic medicine, it works differently from normal medicine. So it depends on your own, your person's individual condition. It depends on your health. And with the homeopathic, doctors, when you go to one illness, he'll do a full scan of your body kind of thing. And we'll find out all the illnesses that you may have. But for these treatments, you see, a person can come with the same illness, but his medication could be slightly different from another person with the same illness, because we look at people's lifestyles, we look at people's diet, their lifestyles, their age, and there are so many factors that we...
एग्जाम्पल मिसाल देता हूँ कि एक पेशेंट जो है उसको सुबह दिन से रात तक उसकी जो सिम्टम है वो बढ़ते हैं, इंक्रीज होते हैं, तो उसकी मेडिसिन डिफरेंट होगी। एक पेशेंट है उसको रात को जो इंक्रीज होते हैं तो उसकी मेडिसिन डिफरेंट होगी। एक पेशेंट जो है वो साल्टी फूड उसको पसंद करता है और दूसरा जो है उसको साल्टी फूड नहीं पसंद आता, इससे डिफरेंट मेडिसिन हो जाती है। ये एग्जांपल मैंने दी, इससे बहुत और इस तरीके से बहुत सारे और सिम्टम होते हैं वो जो हम देखते हैं, उससे पता करते हैं, डिजीज के मुतालिक भी होते हैं और बाकी लाइफस्टाइल के मुतालिक भी होते हैं।
So homeopathic medicine works in a very different way from the modern medicine. It works on the person individual stage. So it depends on how your lifestyle is, what times you have this certain illness. Some people have it through the day, people have it maybe through the night. So a person that has illness through the day, his medicine may be different from the person that has it at night time. So it works in a very different way, but alhamdulillah, it's a medicine that does work, is guaranteed to give you a cure. But look, the thing is, now you can take medication, right? But if you don't take the precautions with it, then naturally the things don't work. एक आदमी कहता है कि मैंने homeopathic medicine I've been taking for the last 3 months, right? Doctor said it's not working. Okay, it's not working, but have you, besides taking medicine, have you listened to the doctor's other advice? Have you changed your diet? Have you started exercising? Have you changed your lifestyle? If your lifestyle is exactly the same as before, then unfortunately the medicine won't have that effect. Right? It won't have the effect. Now, in order for you to get better from any illnesses, you need to find out, okay, I've got this certain illness, I've got gastritis example. Okay, I know the symptom, this is a gastritis. Okay, then you need to understand what are the reasons for this illness. So maybe you smoke, maybe you drink, maybe you do exercise at all, or maybe you have junk food more than you should do per week. Now, you know all the reasons. Maybe you don't sleep at night properly. You're up watching movies or on social media till late hours. You're not sleeping right. Now, you got these factors which are causing you this illness. These are the reasons now. Okay, these are the reasons now. So now you understand the reasons, you know the reasons. So you come for the treatment. You come to Al-Markaz Homeopathy Clinic and you get a medication. Dr. Abaid Rahman gives you medication, does your full, consultation, gives you medicine. And a month later, 2 months later, and you say, oh, Dr. Saab, he doesn't know what he's talking about. Let's say he took money from me and I'm not treated, I'm still ill. But then you look at your own self. Okay, you've been taking medication on time for the last 3 months, right? But have you changed your diet? Have you changed your sleeping patterns? Have you stopped smoking if you smoke? Have you started exercising? If you've not done none of that, then don't expect the medicine to work, because
reason वही रहे तो वही बात है ना कि कुएं में जो गिर गया कुत्ता तो उन्होंने पानी सारा निकाल दिया लेकिन कुत्ते को ना निकाला तो वो कुआं कैसे साफ हो?
Doctor, I'll give you an example, right? Look, right, if a dog falls into a well, right, you take all the water out of the well, leave the dog in there. Right? There's no point in that, is it? So you take the dog out first, right, and then you take certain amount of water out to purify the water. Right? So brothers and sisters, look, end of the day, you know, Allah Ta'ala has given us this body, and Rasulullah Sallallahu Alaihi Wasallam said that the body has a right over you. Our body has a right over us. What is the right over our body? We have to look after it. We have to look after the physical body, and we have to look at the spiritual body and also the mental body. We have to look after the body. And how you look after the body is that you know, first of all, you try not to stress over irrelevant stuff, and you know, you have a trust in Allah, and you pray. Prayer is one of the best form of exercises for your mental health and also your physical health. You know, you pray 5 times a day. You read the Quran daily. Every day, you know, even a line a day. The Quran has cure for every illness in there, and it has solution for every problem. So you read at least even a line a day.
एक line भी शायद पढ़े लेकिन
translation के साथ. Translation is, you know, read your translation, right? So you understand it, and then you send the salutations upon Nabi Sallallahu Alaihi Wasallam. You know, you do a kasrat. You know, the Root Park, right, is one of those you call it ibadat, right, which is never rejected. Your namaz, your roza, your hajj can be rejected. Possibility is not accepted, but Durood Sharif is one thing that which is always accepted. Rasulullah Sallallahu Alaihi Wasallam said that whoever sends salutations upon me once, Allah Ta'ala will bless him 10 times. Forgive 10 of his sins. It could be major sins or minor sins. Forgive 10 of his sins and raise a person turning anxiety. And through Durood Sharif, there's cures. Nabi Sallallahu, he was a cure, Sallallahu, and he is a cure. His cures through them. So we've been through this the gastritis. The next part of the program now, inshallah, is we have a number of questions, Dr. Saab, from our listeners. And brothers and sisters, if you have any questions related to gastritis or any other health issue that you may have, give us a call. Our number is 570900. That's 01274 570900. This is the studio number. You can give us a call on the studio number, and you know, you give us your question and we'll answer them to the best doctors I can. Dr. Saab, I have a question from Hamza Rashid. Okay, his question is, Salam, my father cannot digest his food. He has gastritis, and he feels bloated. He's been having medicine like Fibogel for many years, but now it's too difficult to lose weight. And he has other underlying health conditions. Is it down to food, diet, or what?
Fibogel जो यहाँ जो दिया जाता है हमारे अपने इसमें इस गोल का छिलका जो है वो होता है, वो फाइबोजेल मेडिसिन उसको दी जाती है. अच्छा, इसमें वो अच्छी चीज़ है वो भी, लेकिन इनको जो प्रॉब्लम है वो उससे नहीं ठीक हो रही, तो इंशाल्लाह हमसे रब्ता करें, ये बेहतर होगा. बहुत ही अच्छी मेडिसिन, जैसे मैंने बताया, वही कि हर पेशेंट में सिम्टम्स के हिसाब से हम मेडिसिन देते हैं. और बहुत अच्छी बात यह है कि कोई साइड इफ़ेक्ट नहीं है हमारी मेडिसिन के, होम्योपैथी मेडिसिन के कोई साइड इफ़ेक्ट नहीं है, कोई नुकसान नहीं है.
Yeah, and he said, you know, he has other underlying health conditions. Is it down to the diet? So, now, brother, you know, if you have any other underlying health conditions, just understand that through homeopathic medicine, it will give you no side effects. You know, other conditions, we can cure them as well, inshallah. And, you know, to be honest with you, this problem of gastritis is mainly to do with diet.
जी, जैसे वो कह रहे हैं ना कि और भी उनकी प्रॉब्लम्स हैं, तो वही बात है, जैसे मैंने पहले बताया कि जब हमारा जो तरीकाकार इलाज है, इसमें जब पेशेंट आता है तो हम उससे सारी सिम्टम, सारे अलामात जो है वो पता करते हैं, उसके हिसाब से मेडिसिन चूज़ करते हैं. तो उस अल्लाह के फजल से बाकी जो उनकी हेल्थ कंडीशन है वो भी उससे बेहतर हो जाती है.
Inshallah. Sister Sumaya Khan, she has a question. I have acid reflux, my stomach hurts. I'm only 23 and it causes a lot of problems. How can I get rid of this? Someone said my stomach lining is messed. Please go into some details. Jazakallah khair. So, sister, acid reflux, 23-year-old. किसी ने कहा कि, you know, stomach lining वो खराब है. So How can she get rid of this? But acid reflux, is that part? Is that through the gastritis? Is it, or the different illnesses?
जी जी, जैसे मैंने बताया कि अगर गैस्ट्राइटिस का शुरू में इसका इलाज ना किया जाए तो फिर बहुत सारी ये कॉम्प्लिकेशन इससे बन जाती हैं। तो यही है कि आए, अगर सिस्टर हैं तो रब्ता करें और डॉक्टर हमारा से अपॉइंटमेंट बनाएं, इंशाल्लाह इनको आफाका होगा, आराम आएगा इंशाल्लाह।
Yes, yes, Sumaya, inshallah, with the acid reflux, we have cure for this at Al-Barakah Homeopathic Clinic.
ये एक अलग पूरा टॉपिक है, इस पे इंशाल्लाह हम ये भी
acid reflux
प्रोग्राम इस पे रखेंगे। तो अब डिटेल में अगर मैं बताऊं तो काफी टाइम।
No, we'll have a special program on this the next few weeks, but for now, if you contact our clinic on 01274 270043 and book an appointment with Dr. Homaira, she's a lady doctor. She will check you, she will examine you, and she will give you medication. And through Allah Ta'ala's will, Allah Ta'ala will cure you. You're only 23, so with illnesses that it does really spoil your lifestyle. You can't enjoy the life, you can't eat properly, and it does have a massive effect. So, my sister, please contact our clinic, and Allah Ta'ala will give you shifa. Okay, next question we have from Muhammad Iqbal Hussain. Dr. Saab, my question is regarding nephews. They are overweight and both suffer from diabetes and have various stomach issues. They are quite young. What days and times are you available to bring my sons down? So, brother Muhammad Iqbal, your nephews, is it? Your nephews or your sons, two of them, you said they are diabetic, they are young. What you can do, inshallah, you can book an appointment. You have a receptionist who looks after the diary of Dr. Abaid and also Dr. Homaira. So please give us a call on 01274 270043. Both Asan number है 270043 270043. Call this number. You can call it now. Sister will answer and she'll book an appointment and you come down, have a consultation, and through Allah Ta'ala's will you will be cured. Okay, एक और सवाल है सिस्टर उज़मा खान की तरफ से. She says, my parents both are diabetic, but my mother has asthma and acid reflux. I don't know if it's gastritis. My father is overweight, and how much medicine would you give them as they already take so many? So ये इनका सवाल है कि both parents they're diabetic.
जी इन्होंने बताया कि आस्मा भी है इनको और इनको डायबिटिक भी है. वही बात आती है कि जब पेशेंट को हम देखते हैं तो उसकी हिस्ट्री सारी लेते हैं, उसके मुताबिक बाकी सिम्टम देखते हैं तो मेडिसिन चूज की जाती है. तो इंशाल्लाह फाका होगा जो है हमारी.
अच्छा, another question, Dr. Sabaya, for you. Sister has a good question within that question there. एक आदमी है ये जो है, right? They take other medication, for their illnesses. Now, could you take homeopathic medicine as well as the other medicine?
जी मैं ये बताने जा रहा था कि जो हमारी मेडिसिन है उससे में कोई फ़र्क नहीं पड़ता कि दूसरी मेडिसिन एलोपैथिक ले रहा है या नहीं. ये एक अलग बात है कि वो जो मेडिसिन दूसरी ले रहा है उसके साइड इफेक्ट हैं, वो एक अलग बात है. लेकिन हम किसी को ये कहते भी नहीं कि उसको छोड़ दो या ना छोड़ो. वो जब पेशेंट, जैसे मैंने पहले भी जिक्र किया था कि एक पेशेंट मेरे पास आता था, उसको 10-12 साल से था आस्मा था, तो वो ठीक हो गया, तो अब उसको दूसरी मेडिसिन की ज़रूरत नहीं है, उसने आस्ता आस्ता उसको छोड़ दिया. तो ये होता है कि हमारी मेडिसिन दूसरी मेडिसिन के साथ ले सकता है, उसका कोई प्रॉब्लम नहीं है.
Okay, so Masha, that's one thing clarified. So if you're taking any of the medicine for illnesses through your doctor, but you come to homeopathic clinic, you can take both medicines side by side. Because homeopathic medicine, it will not give you no side effects. It will cure you, inshallah. So it will not give you any side effects. So next question was Uzma. Sister Uzma Khan. Okay, we've done that. So your both parents are diabetic, but my mother has asthma, acid reflux. So inshallah, with your gastritis, if you go speak to a doctor and they will do certain tests, blood tests, etc., and they'll tell you they'll diagnose if it is gastritis or not. And if it is, then you contact our clinic, and inshallah, and we will give your parents medicine through which, through Allah Ta'ala's will, they will be cured. Okay. Ek sawal from a brother. I have been overweight. I sit down around 12 hours a day working. I had an operation. A chunk of my leg had to be removed. Astaghfirullah. Allah give you health. Now I suffer from walking, acid reflux, etc. So yeah, Bhaiya is overweight. 12 घंटे काम करता है. He's always sitting up 12 hours. He had an operation where a chunk of his leg was removed, and now I suffer from walking. Obviously, with the leg, he's unable to walk as much, and he has acid reflux. So इनके लिए आपका क्या advice है डॉक्टर साहब?
जी वही बात है कि ज़ाहिर बात है उनकी प्रॉब्लम जो है जैसे बता रहे हैं कि वो 12 घंटे काम करते हैं, एक्सरसाइज वगैरह नहीं है, ओवरवेट हो गए, तो हमारी मेडिसिन इंशाल्लाह काम करेंगे इन पे भी, लाइफस्टाइल में, डाइट में थोड़ा सा उनको.
See, when a person is overweight, right, best way to lose your weight is through your diet. जैसे कहते हैं when a person goes to the gym, it's the nutrition, the personal trainers, what they say is, they say 80% is diet and 20% is exercise. You can exercise hours and hours, but if your diet is no good, it will not give you no results. But if your diet is clean, you exercise a little bit, then you will get the results. So my brothers, my sisters,
fatty diet को कम कर देना.
Yeah, so fried food, fatty diets, and the problem that we have is when we diet in a very wrong manner. हम ऐसे करते हैं कि वो eat nothing throughout the day. पूरा दिन कुछ नहीं खाएंगे, शाम को will eat the whole meal in one.
उल्ट होना चाहिए, सुबह का नाश्ता जो है वो हैवी करें, दिन को जो है वो थोड़ा सा कम रखें, और जो रात को है वो बिल्कुल.
वो कहते हैं न्यूट्रिशन कहते हैं कि सुबह का जो ब्रेकफास्ट है, should have a breakfast like a king.
बिल्कुल.
Should have lunch like
और मिक्स करना चाहिए. ये भी थोड़ी सी मैं यहाँ आपकी बात काटने लगा हूँ कि मिक्स जो है ना वो फूड करना चाहिए, स्पेशली नाश्ते में, क्योंकि रात को जब बहुत सी जो हमको वीकनेस होती है, सारे मिनरल चाहिए होते हैं, विटामिन जो भी चाहिए होते हैं, तो मिक्स फूड में सब कुछ मिलता है. थोड़ा सा फ्रूट हो, थोड़ा सा सारी चीज़ें, मैं एग्जांपल कह रहा हूँ कि मिक्स करना चाहिए उसमें.
Yeah, so your breakfast, some people now same breakfast every morning, have a variety, have a mixture. I think one thing you should include in your breakfast is fruit juices. Proper fruit juices should include fruit in itself, maybe an apple or banana or orange, one fruit at least. Have bread, wholemeal bread, and have certain cereal, but you try not to have the processed foods, which are not really good for you. Have as much natural food as possible, because you see, all the illnesses are mainly through your diet, what you eat.
जो हमें फूड जो है हमें वो ब्रेकफास्ट में खाना चाहिए, वो हम रात को खाते हैं या दिन को खाते हैं.
We do, and say breakfast like a king, lunch it says something about lesser, but you should an evening meal like a pauper. जो शाम का खाना होना चाहिए वो बेकारी की तरह होना चाहिए. You should have less than it, because after eating you're going to go to bed.
और टाइम ये भी है ना कि टाइम किस टाइम खा रहे हैं वो भी देखना चाहिए.
हाँ.
रात को बहुत लेट खाते हैं, जो जंक फूड खाते हैं वो बहुत लेट खाते हैं,
खा के सो जाते हैं.
तो 1 बजे सुबह का टाइम होता है, 1 बजे 2 बजे रात के मिडनाइट जो है 12 बजे, इस टाइम जो खाते हैं तो फिर बहुत लेट होता है वो.
Yeah, true. So my brothers, my sisters, alhamdulillah, we've covered the topic of gastritis today. We've got another 5 minutes to our program. Next week, again, me and Dr. Abaid Homeopathy will be here from 10 o'clock till 11 o'clock on radio Mark 107.1 FM. And next week, we're talking about stroke.
Inshallah.
Our topic next week is stroke. We'll be talking about what is stroke, what are the symptoms of strokes, what are the reasons for strokes. And when you know reasons for such illness, right, then you can avoid them things, right, and that'll prevent the illness. And again, which kind of people get strokes, and what are the treatments once a person has had a stroke. This is next week's program. We'll be talking about stroke. Today we spoke about gastritis. So my brothers, my sisters, if you have any illness, including gastritis, you have any illness, please give us a chance at Al Markaz Homeopathic Clinic to help you cure your illness through our medication. Our clinic is open Monday to Thursday and Saturday. So Friday and Sunday we are closed. And you can call our number, which is 01274 270043. That's 270043. Book an appointment. We have Dr. Abaid Homeopathy with many years of experience and qualifications. We have Dr. Humaira, who was also qualified practitioner for the sisters. They want a lady doctor. And inshallah, book an appointment, and inshallah, to the will of Allah, you will be cured. So Dr. Saab, last few words from you for today's program.
जी लास्ट फ्यू वर्ड्स यही है जी कि हमेशा की तरह अल्लाह को याद करें, अल्लाह का जिक्र करें और अल्लाह के जो मखलूक है उससे अच्छा सलूक करें, खुद खुश रहें, सबको खुश रखें.
That's a beautiful message from Dr. Saab. End of the day, Dr. Saab, I believe one of the biggest cures for illnesses is happiness.
जी जी.
Right? If you stay happy, and what's the best way to stay happy is to keep others happy. When because of you, when other people are happy because of you, naturally that'll give you happiness.
देखिए जी, ये एग्जांपल ये है इसकी कि हमने कुछ सफ़र करना है, यहाँ से ब्रैडफोर्ड से अगर लीड्स जाना है तो किस तरीके से जाएं. तो अगर हम बाइक पे जाएंगे तो तकलीफ से जाएंगे, बहुत टाइम भी लगेगा. अगर बसेस पे जाएंगे तो फिर उसमें भी वही टाइम लगेगा और 2-3 बदलनी पड़ेंगी. अपनी कार होगी तो उसमें डिफरेंट होगा. तो यही बात है कि हमारा सफ़र जो है ज़िंदगी का, वो शुरू से आखिर तक का वो तो है जितना होगा. तो उसमें हम खुद अगर अच्छी ज़िंदगी गुजारें, खुश रहें, दूसरों को खुश रखें, तो हमारे जाने के बाद लोग हमें अच्छे लफ्ज़ों से याद करेंगे. और ज़िंदगी में भी अगर हमारा कहीं जिक्र होगा तो हमारे पोस्ट में यानी कि हम मौजूद जहाँ ना होंगे तो लोग अच्छे लफ्ज़ों से हमें याद करेंगे.
Yeah, so beautiful message from Dr. Saab, that life is a journey and we have to go through this journey in a very nice way. Be happy yourself, keep others happy, and look after your health, because health is your biggest wealth. There's no bigger wealth than health. If you got health, you got everything in the world. And if you have no health, you can have the biggest wealth. You can be a millionaire. If you don't have the health right, you can't enjoy that million. You can't enjoy your life. So health is the real wealth. My brothers, my sisters, we are here at Marcus Homeopathic Clinic to give you that opportunity to give you a better health through natural medication with zero side effects. You can contact our clinic if you have any kind of illness, from gastritis to asthma to stroke to stress, depression. Depression is a very big illness, and we have cure for that through homeopathic medication. And inshallah, Allah Ta'ala will cure you. And ultimately, we trust in Allah, we turn to Allah, we pray to Him. Allah Ta'ala gives us best health, gives our families best health, gives all our friends best health, and give everyone us best health, iman, and give us a life of goodness and end in goodness. And inshallah, when we leave this world, we unite in paradise, in Jannah, which is our ultimate goal. And inshallah, that is our ultimate goal. And to get to that destination, we have to go through this journey of life. And let's go through this journey of life in a good manner, in a good way. Let's look after ourselves, look after our families, look after our friends, our neighbors, and look after others. Rasulullah Sallallahu Alaihi Wasallam said that love for your brother what you love for yourself. Love for others what you love for yourself. Now, if you do that, Allah Ta'ala will give you the best life. So again, today's program is over. Until next week, our next week's program, we'll be talking about stroke. If you had stroke ever before, inshallah, you can tune into us and we'll talk about how to prevent it for future. And until then, inshallah, assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu.